name is Wendy Brzezowski, and I am the OT account manager for Simucase. My background is as an occupational therapy assistant, and with Simucase, I provide all of the training, and I will provide any assistance for faculty and students as you use your Simucase. If you have any questions, you can always reach out to me. At the end of the presentation, I will show you how to get in touch with me. So Simucase, just a little background, is an online computer-based simulation program that offers simulations that are actually really clients having treatment with an occupational therapist, and then you are going to be the ones that are making all of the decisions in the simulation. So in simulation literature, we know that simulation allows students to bridge the gap from the classroom to the clinic. It provides a safe learning environment and will give you an opportunity for repeated practice and to learn from your mistakes. I do want to encourage you at this point that when you do start doing the simulations, that you work a simulation from the start to the end and don't just keep stopping and restarting a new one. It's expected that you will make errors as you begin. You're learning as you go. But the one nice thing is once you do submit that case, you can look at your report, take a look at the errors that you made, and go back and start again. Simulations give us exposure to low incidence populations and an opportunity for confidence building and reflective practice. So in the Simucase library, we have assessments, intervention cases, part task trainers, and an observational video library. Simulations will be scored on your clinical decision making. It is a competency scoring rating. So you will earn points for reflective decisions and lose points for poor decisions or rejected decisions. So if you are taking notes, a rejected decision is a decision that you make that is incorrect, and it's incorrect for one of these 4 reasons. It's incorrect because it's insensitive, because it's developmentally inappropriate, because it's redundant. You've asked the question once and you're just rewording it. You're doing 2 similar assessments that are going to give you the same results and you only needed to do 1. Those are examples of the types of redundancies you might see. And then lastly, the use of medical jargon, especially when you're doing interviewing. So those are the reasons that you would lose points. There are also decisions within the simulations that are just acceptable. These will result in no points lost, but no points will be awarded. And I will show you examples of things that are just acceptable when we do the demonstration. The points earned in each section are added together, and that will determine your overall competency level. 90% or higher is a mastery level, 70 to 89% is a developing level, and anything 70% or lower is an emerging competency. So before we get started and go into Simucase, I just want to touch on HIPAA and maintaining a patient confidentiality before we get started. So because you are evaluating and treating real patients, please keep in mind all of the HIPAA compliance that you are learning and treat every simulation with respect. Do not share confidential information with other students until you get to the debrief session, because they're your clients while you're treating them. Once you get to the debrief session, that's a good rule of thumb. That's when it's okay to talk to each other and to share decision making. I also want to encourage you to listen to the responses carefully as you go through the simulation. Many times there will be information that you'll need later on. So clicking correctly on the questions is only half the battle. You have to listen and make the most of what the clients are saying so that you can make the connections with your client and your coursework. I also encourage you to use your resources. So as you're going through the simulations, you have all of your notes from class and your books and your instructor. You have a lot of resources, so we encourage you to use them. We'll go ahead then and go into Simucase. So if you've created your account already, this is the page you will see if you elect occupational therapy as your profession. But you will see that you can drop down the box for all professions here, and you do have access to all content. You're talking about aphasia in class and you'd like to see an aphasia client, you can go to the speech language pathology simulations and you can take a look at some of the content there. Same thing in the video library. So when we look in the video library, while it will always come up for your occupation, you can access the other occupations or all professions when you're searching a video. So if we stick with occupational therapy and drop the topic box down, you'll see that the topics here will lend themselves to occupational therapy. And if we were to choose activities of daily living, you can see that all of the videos that have any content with activities of daily living would be present here. If we choose Ed and the Reacher, that's a very short clip, 34 seconds. If I hover over it, it lets us know. And when we do click on it, you'll see that you'll get the description below. Everything is closed captioned and you can full screen it.
Good. Now, to get all these things off the floor, we're going to use something called a reacher. So when you squeeze this, it'll...
So then you can see a brief clip of Ed using the Reacher. And that's how the video library works. It's very self-explanatory, but I do want to let you know that if you're assigned to watch videos, that those videos that you watch will then be transferred to the faculty dashboard, and your faculty member will know if you've watched the assignments. We can then go into search simulations here. And you'll always come into the OT library if you're with your profession being occupational therapy. You can choose your simulations by what type they are. So today we're going to actually take a look at Ed, and he is an assessment case. If I would hover down to assessment here and click on it, all of the assessment cases will show up, and you can see Ed is the one at the bottom. I could have searched him by name as well. And when you do search by name, if you're not going to search by simulation type and you search by name, be cautious because there are several simulations for the same client here. And in Ed's case, we did do his assessment and 2 treatment sessions. So when you're receiving an assignment, make sure you're completing the correct Ed or the correct Frank, because there are multiple simulations for Ed and Frank. So for Ed's assessment, when you first sign into Simucase, everything is going to say launch. There will not be a restart or resume until you actually launch the case. Once you launch, it will always be restart. You can see here I have resume and handouts as well. If I look in the handout section, what you will see is you will see an assessment form. So you can print this and use this to take notes on. The ACOTE standards are also here. So any of the ACOTE standards that are met through Ed's case are there. But we're going to go ahead and start Ed's assessment. We are going to work on it in learning mode. You do have the choice between learning and assessment mode. When you choose learning mode, you'll receive feedback as you go. When you choose assessment mode, you receive no feedback. It's a summative assessment, and you don't get the feedback until you hit submit. We'll go ahead and start in learning mode. And when your simulation loads, it will load to this screen. And if you're taking notes, I would like you to always work with the clipboard open. That's a good practice. So we'll show the clipboard. And you can see on the right-hand side of your screen now, there is a clipboard that has appeared. Think of this clipboard as the clipboard that you would carry into the room when doing an assessment. This is where you will put your notes, and any decision that you make during the simulation will end up here in the clipboard. When we work the simulation, we're going to work left to right. So just like reading, we'll read it left to right. We'll start taking the case history. We'll talk to any collaborators that worked with our client. We'll make a clinical hypothesis. We'll do the assessment. We'll make our findings, and then we'll make a recommendation for the client. In this case, you see the circles at the top of the screen, and because we are using learning mode, when we make good reflective decisions, the circles will fill up with color. When we make rejected decisions, some of the circle that we've gained will be lost. So when you make good decisions, you'll gain points, and when you lose points, it will be because you've made a decision that was rejected. Now, the closer you have the circle to being full, the closer to 100% in an area that you have. So think of this circle as a pie chart. So the closer to being full that it is, the closer to 100% that you are. You can always move on even if you don't have 100%. So when you're taking the case history, maybe you've asked a lot of questions and there's just still a sliver that's missing and you can't decide what that last question is, or maybe you've even made an error and you can't get the circle completely filled. You can still move on, and you can get a 90% or better on the whole simulation without having every circle completely full. So we'll go ahead and start the case study here at the bottom of the screen.
Ed is a 78-year-old male who experienced a stroke 5 months ago and was discharged home approximately 2 weeks ago. He previously received occupational therapy services in an inpatient rehabilitation setting, followed by subacute rehabilitation. Ed, his wife Yvonne, and an occupational therapist are involved in this simulation. You are the occupational therapist completing this home-based evaluation.
So you can see that all of the videos within the simulation can be full screened, and that is throughout the whole simulation. We'll start by taking the case history. In the case history section, the first thing that you see here is that...
My name is Ed. I'm 78 years old. I live in Scottsdale, New York.
That Ed will introduce himself. And then you'll see here on the left-hand side that you will see all of the topic areas where there will be questions under each tab. If you'd like to see what all of the questions are before you start clicking, you can generate a PDF of all case history. And when you do that, you will receive a list of all available questions. Now, all of the questions are available to you, but much like most of the tests that we take, we only want to pick the ones that are going to be most correct. So we will look under identifying family information, and you'll see here, review the case history intake form. That sounds like a good place to start. And we will click it, and you'll see that we do have the medical record here for Ed for his intake form. So because these are real clients, we do have medical records for them and we are able to build them into the case, and there will be information found in the record that's found nowhere else in the assessment. So you can see here that it does say that his primary language is Taiwanese Mandarin, and that's the language he speaks in his home, and he speaks some English. That will be good information for you to have as you move forward. Another thing you might notice here is he doesn't completely fill out the pain scale. So those are things to note, and since we did note that he speaks Taiwanese Mandarin, the very next question here is, I see from your intake form that your primary language is Taiwanese Mandarin. Are you comfortable communicating in English for this evaluation? I'm going to click that, and I want you to pay attention to the upper right-hand corner of the screen. So you'll get this green bar.
Yes.
He says yes. The green bar tells us you're making good choices. If I ask, tell me about your family, you'll get that same green bar telling you that you're making good choices.
I have one daughter, one son.
Now, when you do create your account, you will notice that when you're setting it up that you have the ability to turn on an auditory response. So if you elect the auditory response, you'll get the green bar, but you'll also get a ping that will happen when you make good decisions, and kind of like a little bit more of a negative tone whenever you make poor decisions. So you can elect to turn that on when you create your account. I'm going to ask him to describe a typical day.
A typical day, I think it's wake up in the morning, I go to brush my teeth, which I can do myself, yeah. And then wash my face. Then after that, I walk to the kitchen area, get my breakfast, and then watch TV. And then after that, then we go to bed again.
So Ed gets tired in the morning and he takes another nap. I did mute this, but I do want to point out that it is transcribed here below the video. And when we go over to the clipboard, you can see that every decision that we've made so far is now being collected over here on the clipboard for us. I'm going to go ahead and ask him a few more questions so we can make our progress meter here fill up a little bit more. You can see there is a sliver of yellow. So I'm going to just go in and ask a few more good questions, and then I'm going to show you what happens when you make a rejected decision. Okay, so I made a few more good choices. We can see our progress meter is building here. I'm going to ask him, I see from your intake form that you have visual disturbance or loss. Explain your vision problems after the stroke.
After stroke, I had double vision. I have trouble see. Sometimes I see double image.
Okay, so we're on the right path, but there is a question here in this list that uses medical jargon that Ed might not understand. So if I ask him, do you have a hemianopsia? You'll
I know
see
what you're talking about.
he says, I don't know what you're talking about. And if you look at the top right-hand corner of the screen, you'll see that now my bar
I
is
know
red.
what you're talking about.
And if we look on our clipboard, we can see now we have redirect number 1. So we're getting our feedback a couple of different ways. We're getting the bar telling us that we've made an error, and then we'll get a redirect. Now, as we make decisions that are incorrect, the redirects will add up. So we have the first one here, and it tells us if we click on it that this question was either insensitive, used medical jargon, or was not developmentally appropriate for our client. If I go into that developmental area, there will be questions there, but if I start asking Ed things like, were there complications during your birth, this time I want you to take a look at your pie chart. You're going to see here that you're going to lose a little bit of that color. So we
I don't
lost
know.
some of the color there. We see the red bar, and now we have 2 redirects. Now, in the grand scheme of things, missing 2 points in a case history where there's lots of choices, you're still going to get a good score if you just keep going and stay the course. So once we take the case history, then we would talk to our collaborators. So our collaborators are going to be folks that have worked with Ed, maybe that he's mentioned during the interview, or that you found that he's worked with when you looked at the case history intake. So a good rule of thumb is to speak to the person that made the referral. So once again, if you are taking notes, speak to the person who made the referral. That is the neurologist in this case.
Hi, I am Marguerite Hill. I am the neurologist who managed Ed's medical care while he was a patient in our subacute rehabilitation facility for about 8 weeks. He was discharged home, and I recommended that he continue with occupational therapy services through home care. I sent an overview of his medical history as well as a discharge disposition evaluation to your clipboard.
Anything that's sent to the clipboard will be over here under Collaborators, and so you can see it's a PDF, and when we click on it, you can see the PDF of his report from the neurologist. Once again, there will be information found here that is found nowhere else in the case. It's very, very important to read your reports and to take notes if you see things here that you think you might need later in your findings. So if we look here and we're looking at Ed's report, maybe we see here that he has degenerative disc disease. So maybe we would want to put that somewhere so we would remember it. So I can click on it and cut and paste it. You can see here this add entry. You can put notes in here. So as I make my findings, as I'm going through his case, I might want to put my findings where I can see them later so that I have them and I can hit save, and now that will stay there. And so when I start to do the findings area, I can refer back to my notes. I can also ask questions of the collaborators. Same rules apply here. Ask the good questions. Don't ask questions that are inappropriate. I would never ask a neurologist how long I should see Ed for occupational therapy, because that's going to be something I get to decide. So that's what you would do with the collaborators. There will be collaborators here that are foils at times. So there's no mention of him having cancer. So if I would choose the oncologist, that would be an inappropriate collaborator. But it might be nice to talk to his wife.
Hi, my name is Yvonne. I'm Ed's wife.
And to find out what kind of goals she might have for Ed.
My goal for my husband are he can take care of himself, more independent, put clothes on, take out clothes, take a bath all by himself, put shoes on, so many things.
All right, so you can interview or talk to any of the collaborators here and avoid the ones that are foils. Now there will be reports from other professionals that Ed might have seen, so you may be seeing other reports on the clipboard as well. So once you're done talking to Ed and taking the case history and you've started to build your interview and your information, then you can then go to the hypothesis area. And here you want to think of this as a problem list and make an action plan. So Ed has had a decline in ADLs since the stroke. So I might want to do an ADL assessment. You can make this as long as you want, make it a problem list and then make a long action plan, or you can make individual hypothesis. This is something that is not graded by Simucase. This is something that your instructor will look at. So this will be instructor preference of how they would like you to do the hypothesis. But this is basically a place where you stop and get your thoughts together before you move forward. And then when we move into the assessment section, we can then see that all of the areas are on the left here. You can generate a PDF of all assessments so that you can see what assessments are available for you to do. Now, just because all of these assessments are available does not mean that they will all be appropriate for ed. So if we look here under ADL, IADL, all 4 of these are either an ADL or IADL type assessment, but not all 4 of these will be appropriate for ed. Ed is no longer working. This is an appropriate assessment for a work adjustment profile, but not an appropriate assessment for ed. So this is where you get to decide which assessments you are going to use. So we'll go into ADL, IADL, and we can look here and see the spinal cord independence measure. Well, that wouldn't be for ed. The COSA wouldn't be for ed. Maybe you're not sure what one of them is. Maybe you don't know what the goal is. If you click on it, it's going to give you a description, the age group, and a reference so that you can learn more about the goal, or you can even click on the full reference list and you can find the reference for the goal and go there and learn more. You will not lose any points until you click administer. So as long as we don't click administer, we can always click on an assessment and learn more about it. In this particular case, the modified Barthel is the only one that would be appropriate for ed, so we would choose it and we would administer it. And when we administer it, right up front, you're going to get the results because you can only really score this if you have your hands on the client. Then you'll be able to watch each part of the Barthel.
Take your time turning. And make sure you reach back.
I'm going to go ahead and mute her. She's going to do three different transfers with Ed. You are, after watching the video, going to answer the questions on the slide. These questions are the skills check. So you are getting scored here for choosing the correct assessment, but you are also getting scored for choosing the right answers as you work through the slides. So does Ed require a walking device for transfers? Yes. Does Ed require assist of one person for at least one component of the transfer? What side should we guard Ed on? We're going to go ahead and answer that incorrectly. Is Ed independent in all components of this activity? This feedback button will only appear in learning mode, but when I use it, I will get my slide graded for me. So I can see if I made any errors. I encourage you, if you have made an error, to watch the video again and then change your answer to reflect the correct answer if you see that you've made that error. You can then move on. Now you can leave it incorrect and you can still move forward in the slide. But one thing you can't do is you cannot move forward without answering everything. So in this case, you can see that we also have open text boxes. Simucase does not grade the open text boxes. These are answers that you will type in here and that will be looked at by your faculty as they look at your reports. So you'd then watch the bed mobility and then you'd go on through the whole Barthel. When we watch bed mobility, it's asking you to describe his movement. You would do some clinical writing here and talk about his arm and leg and posture. So we can go ahead and answer that one. When you're finished with the Barthel, you would just finish it and then move on to the next area. So if you were to go into this behavioral psychosocial area, the stroke impact scale is here, and this is not going to be an assessment that is a video component. This one is going to be a report. So he completely filled out the report, and now you're going to synthesize the information and answer it here on the side. So those are 2 different types of assessments that would be within Ed's case. All right, then you would move on and you would make your findings. This area also has a PDF. and you can take a look at all of the findings. And you remember earlier we had written a note over here that he has degenerative disc disease. So maybe we would go into findings and we would go and look in the area of musculoskeletal and find that one and click it. And you can see that was correct. We gained some points in our circle. In balance and falls, we do learn that he has falls since he's been home. He tells us about his vision issues. So we do know that he has diplopia. We do a visual screening and find out he has decreased visual acuity. So you can see our progress meter is filling up nicely. One thing I want to point out here is once you make a selection, you can't unselect it. So if we would have chosen depth perception dysfunction, you can see I lost some of my pie here, and I can't take that away. I will have another redirect on my clipboard. So we've made 3 incorrect decisions. That's how you make your findings. And then you go into the recommendation section. You will have 5 recommendations to choose from. You want to choose the one that is most correct. When we choose the correct one, this is what a full progress meter would look like, and the other ones, all the bubbles will go away. You only get 1 shot at that. So if I would have chosen incorrectly, I would not be able to choose again. I can then write long and short-term goals if they were assigned. The other thing that is available to you is all of the billing codes are back here in the assessment area. So you can choose the proper billing code, and if you're assigned to do so, you can put your billing codes in once you reach that recommendations page. You can add entry and put your billing codes here in the add entry and save. So at this point, you can save and exit or submit. I encourage you to save and exit. It is best practice to save and exit if you go get a coffee or walk away from your simulation for any reason. Remember that you are working on the internet, and if you are using Wi-Fi and your Wi-Fi drops, you could lose some of your work. But I also do want to let you know that if that ever happens to you, that Simucase is saving your work behind the scenes for you. You may only lose about 10 minutes of your work, but you will have to contact customer service to find your report for you. But best practice is to save and exit. I do have students that will leave the cases open for 12 or 13 hours and it will time out and they will end up losing the whole case. So you do want to save and exit. But in this case, we're going to submit. And when we submit, we get a report right away. So right away, you get a visual of how you did. You can see we only got a 28%, so we'd have to start again. On the skills check, we only completed 2 of the 10 sets of questions that we would have had to do. And you can always export your final report and take a look at that. And you should always look at your final report once you hit submit. Anything that you've done incorrectly will be in red. And all of those skills checks that we were answering are individually graded. So you can see the ones I left correct are correct and the other ones are incorrect. So that's your final report. You will want to take your final report with you to your debrief session because those are all the notes from every decision that you made in the case. Now at this point you could restart Ed or you could select a new simulation. If we go back and select a new simulation, from this page you can see right above your name there'll be the word transcript, and this is another way you can see your reports. So any simulation that you work in and you submit it, all of your transcripts will be here. You can then look at your final reports and you can see how many times I've done Ed. So every time I've ever done Ed, all 74 of them are right here. You can download your final report and take a look at it anytime. So that is Simucase. What you can do if you need to get in touch with me is you can email me at help@simucase.com. I do get all of those emails. You can call me or you can get on the live chat between 12 and 7 Eastern Standard Time, Monday through Friday, and myself and my colleagues are there to help. We can answer any questions that you have about the platform or the cases. We will refer you back to your instructor if it is a question related to how to treat the client though.